So we are doing our presentation on autism spectrum disorder. First, we're going to start with the characteristics. To start off, we have the characteristics of autism spectrum disorder. By definition, autism spectrum disorder can be characterized by difficulty with social communication and restricted repetitive patterns of behavior, interest, or activities. In children or early on in development, you may notice that the child shows deficits in social emotional skills, such as building relationships, having conversations, social awareness, or the ability to read facial expressions. You may also notice a lack of nonverbal communication and the use of gestures that should have already started developing at a certain point. This could include gestures such as pointing or making eye contact, which will result in a use of other methods of communication, such as crying, tantruming, leading you to the specific object, and other methods of communication. Individuals with autism spectrum disorder also engage in sensory behaviors of not liking the feeling of certain materials, food aversion, stereotypy behaviors such as stimming, or fidgeting behaviors. Lastly, some more examples of possible characteristics of autism spectrum disorder could be struggling with expressive and language impairments. Children or individuals with autism spectrum disorder may struggle to effectively communicate their feelings or their needs, as well as understanding other things that people are trying to tell them. So some risk factors or causes of autism. There may not necessarily be a specific cause of autism. There are many different factors that could lead to autism, but just because someone has been exposed to any of these risk factors, it doesn't mean that it's going to be prevalent. Although when it comes to identifying the different risk factors, we look at environmental, genetic, and biological factors. Some examples of these factors that could lead to autism are seen in this graphic. Some environmental risk factors could include oxygen deprivation at birth, air pollution exposure, and parental age, and social determinants such as access to healthcare. Some examples of biological factors could be brain nerve cells, immune system disorders, and lack of neuron communication. Lastly, some examples of genetic risk factors could be gene changes, autism risk genes, parents carrying specific genes linked to Rett syndrome or Fragile X syndrome, or a family genome. So the impact of overall development that autism spectrum disorder has. It can relate back to some of the characteristics we mentioned. People with autism spectrum disorder may need to see professionals such as speech therapists, occupational therapists, behavior therapists, and many others. Um, sorry, and other functional living skills needed. See people for other functional living skills that they need for everyday living. Some impact on development may include a delay in gross and fine motor skills such as writing, writing utensils, balance, grasping, running, jumping, and so much more. Functional communication is another aspect of development that may be impacted or delayed due to autism spectrum disorder. Some children may have communication skills, but they may not be able to functionally communicate through questions, comments, or conversation. Autism spectrum disorder can also impact language and speech, whether it is a child struggling to understand instructions or struggling to read, or it could be a child struggling with the actual articulation or speaking of words. Again, poor visual skills and eye contact, struggling to keep joint attention or responding to their name when called. A quote I found that also mentions the impact of autism spectrum disorder has on speech skills is sometimes children with autism spectrum disorder can echo what you say as their mode of communication instead of that spontaneous speech, or they engage in scripting or jargon, which is speaking things that they've heard in the natural environment or speech that is not fully developed to be understood or used functionally. Autism spectrum disorder brings upon speech and language skills that need to be addressed in early intervention so that communication skills can be used in a way that they can be understood.
Language development. Very good. All right. As Carolyn said before, people with autism have challenges with communication and social skills. The ability of children with ASD to communicate and use language would depend on their intellectual and social development. You know, some children with ASD may not be able to communicate using speech and language, and some may have very limited speaking skills. It also impacts the impacts of language development includes categories with communication, social skills, and different behaviors. It's also noted that all people with autism have some degree of challenge with communication, the social skills and the other behaviors, such as making friends or maintaining relationships at work or school. Children with, let's see, children with ASD may have difficulty developing language skills and understanding what others say to them. They often have difficulty communicating non-verbally through hand gestures or eye contact or facial expressions. A person with autism may have these challenges in forms of communication where they could language regression, where they lose some early words that they have developed. It can be a little bit hard to understand. I'm going to butcher this, but it's echolalia.
Echolalia.
Echolalia. Okay. Well, learning what that is, the repetition of words or phrases that they heard recently. Uh, they could talk very little or small. Uh, use challenging behaviors. Uh, Understanding and using pointing gestures or waving, understanding words, following directions, hyperlexia, which is learning to read or write. And some children with autism read early, but they do not understand what they read. And they can also have problems with having conversation. All right. A person with autism may also have challenges relating to others, and it may seem like they're not interested in others or making friends. It can be hard for them to share attention with someone else or focus on the same object or event, join in play with others, share toys, uh, respond when others invite them to play or talk, understand how others feel, taking turns in conversation or play, and like I said earlier, just try to make and keep friends. All right. And some of the behaviors that somebody with autism may have, they'll repeat certain behaviors, including hand and body movements. They would cry or laugh or become angry for just unknown reasons. They'll get upset on certain sounds and smells and textures. Only like a few foods. They could be based on like look or texture, and show interest in only a few objects or topics. All right. And even though autism spectrum disorder is a developmental language disorder, I do want to highlight some of the strengths that a person with autism may have. People with autism spectrum disorder will have strengths where they have the ability to learn things in detail and remember information for long periods of time. They're strong visual and auditory learners, and they're really great at math, science, music, and art. All right. What are some of the sociocultural factors? Well, it should be noted that autism spectrum disorder affects people of all backgrounds, shapes, sizes, cultures, and heritage. Different cultures factors can change how individuals experience autism in their everyday lives. The influence with their interactions with their family and community and schools and health services. These cultural factors can impact how autism is understood and how it's accepted in different communities. According to the Center of Disease Control and Prevention, there's no research to date that has identified any biological or genetic differences that would affect autism's occurrence across different groups. Yet, uh, there are clear like gender and racial and ethnic disparities in the diagnosis and treatment of autism. Uh, so with that said, it's important to note the cultural myths about autism and the other disabilities can prevent people from seeking help. So here are some of the cultural factors. You know, it's important to note too that the clinical biases can come into play, and with patients with certain cultures, for example, clinicians may be quicker to assign symptoms of autism to community deprivation or behavioral issues. As you can see, all these different factors of like language, geographic location, religion, nationality, the economic status that families have, gender, different beliefs and values, family structure, and you can see that, for example, of this would be that researchers show that in communities like Los Angeles, non-white families or recent immigrant families can have more of a difficult time getting developmental services when often delays this proper diagnosis. All right. And some other factors that can influence diagnosis and treatment. Uh, we have individual factors. So this is about like race, sex, and developmental factors. An example of this where would be uh, males are 4 times more likely than females to be diagnosed, or non-Hispanic whites are diagnosed with autism than Hispanics or non-Hispanic blacks. Uh, you can see with family factors, this involves the social economic status, there's social reports and family structures. These factors can determine whether a family has the drive or capacity to meet the needs of the child with special healthcare needs, including, and it also includes like direct costs of like what the treatment could be. And then you have community factors, which influence is or like the organizations or institutes or uh, these different formal networks that you have in like a child's family's like area where they live. I like this little quote that said, "Public health researchers often note that health can be more accurately described by one's zip code than one's genetic code, because people with similar characteristics tend to cluster in neighborhoods." Uh, and some policy factors would have to actually be laws and social norms on like a local or state or regional or national level. For example, in the United States, uh, the Individuals with Disabilities Education Act mandates delivery of free, appropriate public education to people with disabilities, including those with autism. So when we look at all these factors and we take that in, we can acknowledge that, uh, that a family's cultural background can provide insight onto how uh, a family thinks about its child's development or condition. And by understanding these social and cultural factors, we can see how it can influence how the family cares for the child and accesses these services. And it's important for clinicians to be aware and make good judgment that must be grounded in understanding the full range of these influences that can, be relevant to identifying the disorder and treatment for autism disorder. So, with all that said, what are some strategies to mitigate the impact to development? So, when it comes to really anything that we have seen with any developmental language disorders, it's best to get early help on for young children with autism, and this could be through local early intervention or preschool programs. So, some strategies include testing for autism, treatment with an SLP, uh, and I will go in detail about the family center practice and medication. So, testing for autism is a good way to start. Testing is usually done by a team of experts who know about autism. This may include a medical doctor, a neurologist, and a developmental psychologist and an SLP. You know, some people with autism don't talk at all. They can talk very little, and can have trouble talking. So SLP may be can test for the person's ability to use augmented and alternate communication, which is ACC, to help them communicate. And what this is just a different alternate form of communication. So this could be through sign language or hand gestures. It could be through pictures, uh, and or it could also be with electronic devices and even like computer tablets that can help them in their way to communicate. Uh, and it's also important to know that all people with autism have social communication challenges, but not all people with social communication challenges have autism. So, what are some treatments that an SLP can do? Well, the treatments really depend on the person's needs. So, an SLP treatment may include, you know, getting along with others in different settings. It could be a classroom, or it could be, just outside and working on play. Using a variety of communication supports. Taking turns in conversation so they can understand how a conversation would work. Moving from one task to a set different task. Uh, and accepting changes and expanding interests. That could be trying new foods or activities or new topics that they might find interested. And then also reading and writing skills. So I also want to highlight another strategy with the SLP, and that's family-centered practice. I think, uh, most children with ASD respond well to highly structured, specialized programs. And when the parents or primary care givers and other families are involved in that treatment program, it needs to be a part of a child's daily life so that they can understand and learn and grow those skills. You know, the goal of family center practice is to, create uh, a partnership between the family so they can fully, participate in all aspects of the child's life and their care. SLP families, some of the practice that we do, center family practice, would be talking about uh, what you are saying you're doing, out loud, and talking about what the child is saying and doing, stuff we have talked about before in our past lectures. Adding extra words for what a child has said, or providing them help for a task, but making sure that you give them the space to let them figure it out and do it themselves, and also providing sensory supports during play. And so lastly too, I also want to add, we want to go through therapy and sometimes with with treatments and stuff like that. With all the other aspects of autism, medication could also help, a health, but you go to a healthcare provider, they may prescribe medication to treat different symptoms with autism. With medication, a person with ASD may have a little bit fewer problems. It could be with irritability, aggression, repetitive behavior, the hyperactivity, the attention problems, and anxiety or depression.
All right.
And so that is our work cited, and that is autism spectrum disorder. So thank you very much, and we look forward to hear all your projects.